Thank you for joining us. This is the Prepare for Medicare presentation, and it's hosted by Chicagoland Medicare and Brickhouse Agency. My name is Nikki Ferret, and I'm the owner of Brickhouse Agency and Chicagoland Medicare, and I'm also a licensed agent. And I have a partner, my sister-in-law, Andrea Ferret. She is also a licensed agent, and she is our business development director. And both of us are ready and happy to help folks with their Medicare insurance needs. So to tell you a little bit more about Chicagoland Medicare, we serve clients in the Illinois, Indiana, and Wisconsin states. And then Brickhouse Agency is our parent organization, and it is licensed in over 30 states. We focus solely on Medicare. So we are a boutique Medicare insurance agency, and Medicare insurance is the only thing we do. We are a full service agency. Education is very important to us. That's why we offer things like this Prepare for Medicare seminar. We also work with clients and customize products, to their particular needs. And we help them enroll in the products. And there are no charges or extra costs to using our services. If you elect to work with one of the agents at Chicagoland Medicare or Brickhouse Agency, there's no charge to you. And we are compensated when and if you enroll in a plan with us as your agent, and in the form of a commission from the insurance company. But it does not cost you any more to work with a professional Medicare insurance agent. So we do believe that education is very important, and that's because Medicare is a very complex and complicated topic. There are a lot of rules and regulations, and they change frequently. So it's just really important to stay updated and informed. 80% of Medicare eligibles are confused about Medicare. So if you fall into that range, you've got a lot of people that are there with you. We talk to people all the time, and they have questions that they've tried to figure out on their own, and it can be complicated. So we like to break things down and simplify things when we can. Medicare advertisements are crazy, especially at different times in the year. In the fall, during the annual election period, which we're going to talk about a little later in this presentation, there are all kinds of advertisements on TV. They show up in your mailbox. You're just kind of inundated with them, so it can be overwhelming. So we want to make sure that that's as least confusing as possible. One thing that we have found is that people make a mistake by not reviewing their coverage on a yearly basis. So if you stay in the same plan year after year after year and you don't kind of check that out, you could end up paying more over the long run than you would have to. And it's really hard to find the information you need sometimes when it comes to Medicare. So again, we would like to be a resource for people, and hopefully this presentation helps get you started. So it is important to make the right decision about Medicare. There are a bunch of enrollment periods out there, and you got to use the right one for your needs. If you miss an enrollment period or you use the incorrect one, you could end up with lifetime late enrollment penalties. So we just want to make sure that that doesn't happen. Medicare insurance does change yearly. So plans come out in the fall typically for the following year, and you got to review your plan. You got to make sure that it's still the right fit for you. You do want to keep up to date, and you want to understand how those changes can affect you. So let's get started by first discussing what is original Medicare, or what is Medicare. It's really important to understand what original Medicare is before you kind of get into some of the other products and plans that are out there. So on the screen, you can see on the left in blue is original Medicare. Original Medicare falls under two parts, Part A and Part B. Part A is your hospital inpatient coverage, and Part B is your outpatient coverage. Part C is also referred to as Medicare Advantage. And it combines your Part A benefits, your Part B benefits, and typically your Part D benefits as well. And then we have Part D, which is your prescription drug coverage. And then we have on the far right, you see Medicare supplements, which are private insurance policies that work with Original Medicare. So we're going to get into a little bit more what each of these are. Original Medicare, again, Part A and Part B. Most people are first eligible to enroll in Original Medicare at the age of 65. Some can enroll at a younger age because of a qualifying disability. If they have been on disability for a certain period of time, then they receive Original Medicare benefits as well. You also must be a legal resident and live in the U.S. for at least 5 years in a row. And those with end-stage renal disease or ALS automatically apply for Medicare or qualify for Medicare. So again, Part A, that helps pay for your hospital and inpatient stays. So your hospital, your skilled nursing, your hospice, and even some home health care. And Part B pays for your outpatient care. So when you go see your primary, when you go see your specialist, when you get x-rays, MRIs, any kind of outpatient service you receive, preventative care, those fall under Part B of Original Medicare. Part A does not have a premium for most people. Most people do not pay a premium for Part A. Part B does come with a premium. So the majority of people out there pay $174.70 per month in premium for Part B coverage. One important thing to remember is you will always pay your Part B premium. So we're going to be talking about some other products here in a minute, but just always know that that premium, whatever yours is, and it can be a different amount than the $174.70 based upon your income. Your income level can make that premium be a different amount than the typical amount, but it's just really important to know that you're always going to pay that Part B premium. There are some things that Original Medicare does not cover. There are some cost and gaps with Original Medicare beyond that Part B premium. So one of the largest costs for Part A is for the inpatient hospital deductible. So your first 60 days that you have in a hospital benefit, that's a hospital benefit period, is when you're admitted to the hospital in the first 60 days. After that, you would pay an inpatient hospital deductible of $1,632. So it's important to know that that deductible could occur multiple times during the year. After your first 60 days that are covered by that deductible, then there are copay days as well. Skilled nursing, you have 20 days at a $0 copay covered under Original Medicare if you qualify for skilled nursing care. But then after that, there are copay costs per day of care. So just remember with Part A, even though there's no premium, there are some deductibles and costs associated with it. With Part B, you have your premium, and then you have a yearly one-time deductible. This year in 2024, that deductible is $240. And then you have a 20/80 split. You pay 20% of the cost of any outpatient care that you receive, and Medicare covers the other 80. It is important to note that Original Medicare does not cover prescription drugs, and it does not cover routine dental, vision, and hearing. So you're going to need to receive those benefits through another plan or product. So when can you first enroll in Original Medicare? So you might be able to delay some or parts of Medicare if you are continuing to work. So we talk to a lot of people that are not ready to retire at the age of 65. So generally you can delay Medicare past the age of 65 without any kind of penalty if you have what is called credible coverage. And if your employer has more than 20 employees that are covered by your group employer plan, it most likely is credible by Medicare standards. We always recommend talk to your HR, talk to your benefit, provider department, and make sure that your coverage is credible. They should be able to tell you that. If you do not have credible coverage. If you're in self-employed, or if you have fewer than 20 employees that are covered by your group plan, then you are most likely going to need to enroll at the age of 65 because your coverage might not be considered credible. So that's the key. Find out if your coverage after the age of 65 is credible. If it is, then you can remain on that plan and delay Medicare. If it is not, then most likely you need to go ahead and enroll at Medicare at the age of 65 to avoid late enrollment penalties. Some people are automatically enrolled in Medicare. So people that are already withdrawing Social Security benefits at least 4 months prior to their 65th birthday will be automatically enrolled into Original Medicare. They'll just receive that card, that red, white, and blue card that we're all familiar with, in the mail. And then they'll have to send it back if they would not like the coverage. If you want the coverage, then you just keep that card. So that's one way to get enrolled. That happens during your initial enrollment period. Your initial enrollment period are the 7 months surrounding your 65th birthday. So the 3 months before your birthday, the month of your birthday, and the 3 months after. There are also special enrollment periods that we're going to talk about later, when you can enroll in Medicare. And there's always the general enrollment period, which lasts the beginning of January through the end of March. That's another time when you can pick up Original Medicare if you've missed your other enrollment periods. So just to give you, a visual of the initial enrollment period, here it is: the 3 months before you turn 65, the month of your birthday, and the 3 months after you turn 65. So again, if you're already receiving those Social Security benefits, you're going to receive your card in the mail, and you're going to be set up for Part A and Part B. You keep that card if you want to keep those benefits. If you have delayed Social Security, if you're not withdrawing Social Security yet, and you do want Medicare, either Part A and or Part B, you're going to need to reach out to Social Security to sign up. The easiest way typically is going to ssa.gov. That's the easiest and fastest way. You can call them as well. Wait times can be long. So if you can do it through ssa.gov, that's the quickest way to take care of that. And if you want to sign up at the age of 65, you will do it during that 7-month initial enrollment period. And again, you can sign up for Part A and or Part B at that time, depending upon your needs. Some people do want to just sign up for Part A. Part A is premium free for most people. And if you're working past the age of 65, maybe you just want Part A as a secondary insurance to your employer group plan. So again, first you need to confirm that that employer group health coverage is credible by Medicare standards. Then maybe compare cost. Just make sure. You can always call us up, have a chat. We can set up an appointment and just do some cost comparison. Let's make sure that you staying on your employer group plan will save you money, as opposed to transitioning to Medicare. So if you do find out that, yes, your plan is credible and it's going to save you money by staying on it, you can go ahead, remain on that plan. If you want, you can sign up for Medicare Part A. It's premium free. It'll just be secondary to your health plan. Now, one thing to remember is if you are contributing to an HSA account, then you do not want to sign up for any part of Medicare, Part A and Part B. You cannot sign up for either of them, or you will have tax penalties. But if you're not contributing to an HSA account and you want to go ahead and pick up Part A as secondary insurance, you could go ahead and get that at the age of 65. Again, visiting ssa.gov is the easiest and fastest way to take care of that enrollment. So now, say that was the route that you took. You continued working, you went ahead and signed up for Part A as your secondary inpatient hospital coverage. Now it's time to retire. You've decided on your retirement date, you are going to have a special enrollment period at that time to enroll in Part B. So a few months before your retirement, plan ahead, know when you're going to retire. A few months before that occurs, go ahead, go to ssa.gov, start the application process for Part B. Make that a smooth transition. When your employer plan ends, you start Part B. You do have a special enrollment period that lasts for 8 months after you stop working or after that group health plan ends. So there is a longer time period, but if you're wanting another Medicare product, there are different enrollment periods that apply to those other Medicare products. So I would recommend, and most people, kind of get that taken care of ahead of time. But you do have an eight-month enrollment period to get that taken care of. Again, SSA.gov is the easiest and fastest way to sign up for Part B once you have your retirement date solidified. So we talked briefly earlier about the general enrollment period. It also runs at the same time as the Medicare Advantage open enrollment period, and that's January 1 to March 31st. So say something happened and somehow you missed all those enrollment opportunity, you missed the enrollment opportunity for your original Medicare benefits. You could always, from January 1 to March 31st, go ahead and get your Part A and Part B during that general enrollment period. Again, it runs at the same time as Medicare Advantage open enrollment period. People that are already, this is for people that are on Medicare and opted to go with a Medicare Advantage plan. If they're on a Medicare Advantage plan as of January 1, they can make a one-time switch from Medicare Advantage plan to Medicare Advantage plan during this time period as well. Another thing you can do during this time period is leave a Medicare Advantage plan and go back to original Medicare and pick up a prescription drug plan. So there's several things you can do during that January 1 to March 31st timeframe. There are some other special enrollment periods as well. Most of these apply to Part C, which is Medicare Advantage, and Part D, which is your prescription drug plan. We talked about when you lose your group health coverage, you get an enrollment period to enroll in that Medicare Advantage plan or prescription drug plan. If you move out of your plan service area, move from state to state or out of the county that your plan is offered in, you can get an enrollment period. People that qualify for extra help, which is people who have a lower income and they get extra help with their medications, they get additional enrollment periods. People diagnosed with certain qualifying chronic health conditions get additional enrollment periods. If you live in an area that offers a 5-star Medicare Advantage plan or prescription drug plan, you will get extra opportunities to enroll in that plan. And then another thing to remember is there is something called the Medigap SEP. It is also referred to as your trial right. What that means is if you have always been on a Medicare supplement, if when you enrolled in Medicare, you went ahead and got a supplement, and that's all you've ever been on, and you would like to try a Medicare Advantage plan, and you have a valid enrollment period, such as the annual election period that runs every fall, October 15th through December 7th. If you want to try, you could enroll in a Medicare Advantage plan during the annual election period. It would start on January 1 of the next year, and you would have a year to try out a Medicare Advantage plan and be able to go back to your Medicare supplement within that year's time period with no questions asked and no health underwriting. And we're going to talk a little bit more about the health underwriting requirements later, but just remember there is a Medigap SEP, a Medicare Supplement SEP, which allows people to try out a Medicare Advantage plan for a year without risk of not being able to go back to their supplement. They are allowed to go back to their supplement during that year. So just keep that in mind. If you have any questions about that, reach out to us or any of these enrollment periods. So I talked about how there are late enrollment penalties. So we want to make sure you avoid those. Part B is one that I really don't see very often. I have seen it a couple times, but basically if you go 12 months where you're not enrolled in Part B and you do not have credible health insurance, you're going to get a late enrollment penalty and you'll pay an extra 10% in premium for every 12 months you did not have coverage. So like we talked about, there's always that general enrollment period where you can get into Medicare. You have your IEP, you have your special enrollment period when you lose coverage. So hopefully you don't miss any of those and you get your Part B and you don't go without coverage. But if that would happen, you could get that late enrollment penalty. One important thing to remember is COBRA does not count as credible coverage. So you can't just depend on a COBRA plan to take you through a long time period. So just remember, don't go without coverage, which most of us, don't want that to happen anyway. But if you do go 12 months without that Part B coverage, you could have that late enrollment penalty. Now, the one that I do see rather frequently is the prescription drug late enrollment penalty. So how this usually comes up is someone, it becomes Medicare eligible. At that time, they're not taking any medications. And so they kind of assume, why do I need to pay for this drug plan when I'm not even taking medications, which makes sense. The problem is if you go 63 days without credible drug coverage after you are eligible for Medicare, you will start incurring this late enrollment penalty. So you can't have more than a 63-day gap of no credible prescription drug coverage. And generally, you will have to pay that penalty for as long as you have Medicare drug coverage. So it could add up over time. So even if you don't have drugs when you first turn 65, just make sure you always have that credible drug coverage, because you never know, when you might get prescribed something, when something might happen. And you don't want to have that late enrollment penalty cost, to have to pay that for the rest of your life. So basically, the penalty is an additional 1% of the average Part D premium for each month you delayed enrollment. So if you only go a couple months, it might not add up to that, although, if you pay it for the rest of your life, it could. But, I have talked to people that have gone 10 years, 12 years without credible drug coverage. Now, when they finally do need to enroll in a drug plan, now on top of that drug plan premium, they have this late enrollment penalty that they have to pay monthly. So let's just avoid that. Try to get on a plan. If you're not taking medications, just get on the least expensive plan that you can find to avoid that late enrollment penalty. So we talked about what Original Medicare covers at the beginning of this presentation. So now let's talk about what other products are out there that you might be interested in. So on the left hand of the screen, we have option one. With option one, you remain on Original Medicare. You actively use your Original Medicare benefits, which means you're actually using that red, white, and blue card when you go to the doctor's office, when you go to your specialist, when you go to the hospital, and you purchase a Medicare supplement policy, which is offered by private insurance companies to help cover some of those gaps, those costs that we talked about, the deductibles, the cost sharing, the 20% that you have to pay for outpatient care. Medicare supplement insurance policies help pay for those costs. Now, because a Medicare supplement policy works directly with Original Medicare, it does not cover your prescription drugs. So now you also add on a separate standalone Part D prescription drug plan as well. So that's option one. Option two is a Medicare Advantage plan or a Part C plan. These are also offered by private insurance companies. They offer you your Part A benefits, your inpatient care, your Part B, your outpatient care, and they often include Part D drug coverage as well. They're a combo plan. They also sometimes offer additional benefits like routine dental, vision, and hearing. So with these plans, you are not using Original Medicare. You are using your Part C Medicare Advantage plan benefits through your private insurance company. So it's a different way to get your Medicare and to get your health insurance benefits. So option one, just for a visual, option one, you remain on Medicare Part A and Part B, Original Medicare. You add that supplement to help pay for those costs, and you add a separate standalone Part D plan. That's option one. So why might someone choose option one? Why might someone want a Medicare supplement policy, also referred to as a Medigap policy? If you want to stay and actively use Original Medicare, which means that you can visit any medical provider, any facility in the country that accepts Original Medicare, they must accept your supplement. So some people like that. They don't want to work with an insurance company's network of providers. They want to go to any doctor that accepts Original Medicare. There's a more predictable cost with Medicare supplements. So with Medicare supplements, you pay your Part B premium for Original Medicare, you pay your premium for your supplement, and then there are fewer costs above and beyond that. There are fewer cost sharing. So if you want to kind of budget and know how much you're spending every month, it might be a better option for you. There are many Medicare supplements out there. We're going to talk a little bit more about that in a minute, and I'm going to show you a chart. So it does matter which Medicare supplement policy you pick, but just know they have fewer copays than, for example, a Medicare Advantage plan. A supplement policy moves with you. So if you're a snowbird and you spend half the year in another state, if you have lots of family or friends that you like to visit in other states for longer periods of time, the supplement policy moves with you. It's nationwide coverage. If you end up relocating down the line, you don't have to change that supplement policy. Some of these plans do offer emergency foreign travel coverage. So if you do travel outside of the country, it might be an option that you would like to look into, or it might be a nice additional benefit for you. One thing to remember with Medicare supplements is unless you have a guaranteed issue situation, you would have to go through health underwriting and answer health questions. So the 6-month period after you enroll in Medicare Part B is called your Medigap open enrollment period. And it does offer you guaranteed issue status, which means you do not have to answer any health questions. You do not have any health underwriting. You just skip over that part of the application entirely. So it's just a really good time to get your Medicare supplement. If you know Medicare supplement is the route you want to take, it's the best time to get it because you're not going to be denied coverage no matter your health situation. Outside of that, outside of a guaranteed issue situation, you are going to have to answer health questions. So here's that chart I told you we'd look at. These are the plans that are out there. I'm just going to explain one of the more popular plans. That's Plan G. You might know someone on it or talk to people who are on it. It is the most comprehensive plan available to someone who's turned 65 after January of 2020. Anyone who turned 65 after January 2020, G is the most comprehensive plan that you can get. So if you look at G, you look at the column of G, it's all in green except for you see that black X at the Medicare Part B deductible. What that means is if you elect to apply for and you get on a Medicare Supplement Plan G at any insurance company, it doesn't matter what insurance company you go with, premiums can be different company to company. They are different company to company, but the coverage is the same. So if you get on a Plan G, you're going to pay your Plan G premium, and then you are going to fulfill your Part B deductible, which this year in 2024 is $240, one-time deductible when you get an outpatient care. And then any Medicare approved service visit that you have will be covered. The cost will be covered by your Plan G. So pay your premium, pay your Part B deductible, and then any Medicare approved service you receive covered by your supplement. So that's what I was talking about when I talked about few to, no copays above and beyond, the cost of your premium. So if you like that, if you like being able to see any doctor, if you like not having to worry about being responsible for bills, you want to just worry about, paying that that premium, a Plan G might be the way to go for you. So again, if you go with a Medicare supplement, you remain on original Medicare, you go with a Medicare supplement, neither of those are going to take care of your drug coverage. So now you're going to need to also apply for a Medicare prescription drug plan, or also called a Part D plan. This will give you your prescription drug coverage. So when you go to the pharmacy, this is the card you will use. There's a monthly premium with these plans, and they can vary greatly. So when you're comparing Part D plans, you can go to Medicare.gov and do that there. You can call us at Chicagoland Medicare, Brickhouse agency, and we can help you compare plans as well. But basically, you're gonna want to look at the monthly premium, yes, but you're also going to want to look at other things regarding this plan. You're going to want to look at its formulary, which is the list of drugs it covers, and you want to make sure your drugs are on that list. And then you're going to want to see what drug tier your drug is on, so you know the cost that you're going to pay, the copays and coinsurance that you're going to pay, because those can vary greatly plan to plan. All of those things can vary greatly plan to plan, even within the same insurance company, because this one insurance company can have multiple Part D plans. So you really want to make sure that the Part D plan that you elect to enroll in is the best fit for your needs. So you know your cost sharing, and you know the cost that you'll have to pay for the year. So now we're going to talk about option 2. That is Medicare Advantage plans. Again, these are combo plans and they offer you your Part A benefits, your Part B benefits, and typically your Part D drug benefits as well. When you enroll in a Medicare Advantage plan, again, you are no longer using Original Medicare. You have all the same rights and protections as you have on Original Medicare, but now you are using your Medicare Advantage prescription drug plan. It is an alternative to Original Medicare. It's an alternative way to get your health coverage. These plans are appealing to some people because they have a low monthly premium typically. Sometimes there are often a multiple $0 monthly premium plans out there available to you. But don't get, distracted by the premium. Yes, it's important. It's great to have a $0, monthly premium, but we have to look at other aspects of these plans. You need to shop these plans very carefully because these plans also can vary greatly even within the same insurance company. Because again, same with prescription drug plans, standalone prescription drug plans. One insurance company can put out multiple Medicare Advantage plans, and we want to make sure that those you compare those plans and make sure that you get the plan that will be the least cost for you. So they all come with different copays. When you look at these plans, you want to look at the summary of benefits or the evidence of coverage documents, and you want to see what the copay cost is for any service you would receive. So that way you can kind of predict your care. These are network-driven plans. So you want to look up your doctors and make sure they're on these plans, because even if you opt to go with like a PPO, which means you can go out of network, you're going to pay more if you go out of network. So the more doctors you can get, more of your doctors that are in network for that plan, the more money you're going to save. You can shop these plans on Medicare.gov as well, just like standalone prescription drug plans. There is no way to look up doctors on Medicare.gov though. So you're going to have to go to the insurance company's website and look up your providers there, or you can schedule an appointment with us and we offer that service for you as well. These plans, most of them have no medical deductible. So oftentimes you'll have no medical deductible. You'll just jump straight to the copay stage. They each come with a maximum out of pocket. So that number is important to look at, just as important to look at as the premium. So the maximum out of pocket means if your copays or your coinsurance ever add up to whatever your maximum out of pocket is, you stop paying, and then the plan will take over and pay the remainder of your copays for your medical costs for the rest of the calendar year. So it's kind of your financial safety net. This is the most I'll have to pay in medical copays for the year. If I just have an unfortunate health year, that's the most I'll have to pay. So the lower the maximum out of pocket, the better. And like I said, most of these offer prescription drug coverage. So you're going to need to shop that portion of it as well and make sure, again, just like on the standalone drug plans, that your drugs are on the formulary, so they're covered by the plan, that the deductible, know the deductible for your prescription drugs, know the cost of each of your drugs copay, which is determined by the tier that they're in. So all those things are important to know. So to wrap this up, there are some yearly things you need to do, yearly housekeeping you need to do to make sure that you remain on the plan that's best for your needs. So first of all, every year in the month of September, Medicare insurance companies that offer Medicare products, specifically Medicare Advantage plans and Medicare prescription drug plans, they must mail out an annual notice of changes booklet. This is going to go either, be mailed to your home, or if you elect it to receive your documents electronically, it'll be emailed to you. But you just want to make sure you review this booklet. It's a very important booklet. It's going to have your plan, all the benefits of your plan side by side with what they are in the current year and what they will be in the following year. And that's important to know because you want to know if there are any changes with your plan to make sure if you want to stay on that plan and just have it roll over to the following year, or if during the annual election period, October 15th through December 7th, if you want to switch your plan for a January 1 effective date. That's your opportunity to change. The annual election period is your opportunity to change your standalone prescription drug plan and your Medicare Advantage plan. During that time period, there's There are no health questions. You can't be denied. You can switch that Medicare Advantage plan. You can switch that standalone drug plan, and it will start January 1 of the following year. We already talked about it, but let's just review the Medicare Advantage open enrollment period, which also runs at the same time as the general enrollment period. It's January 1 through March 31st. During that time, you can make a one-time change from Medicare Advantage plan to Medicare Advantage plan if you were on a Medicare Advantage plan from the beginning of that year. You can also disenroll from a Medicare Advantage plan, go back to original Medicare, and enroll in a Part D plan. So there are a couple things you can do during those first 3 months of the year. Do know with Medicare supplements, there are many benefits to them. Do know that the premiums will increase typically on a yearly basis. So just look out. Each company puts out their premiums increases different times during the year, but every year, and oftentimes they're on in the spring, summer, but they can be different times during the year. But you'll receive a notification in the mail, and it's going to let you know what your new premium will be. So make sure you look out for that notification as well. Please reach out if you have any questions. That's what we're here for. We want to, be a resource for you. If you have any questions regarding Medicare benefits, if you have any questions regarding enrollment periods, please reach out. You see my email address and phone number on the screen, as well as Andrea's email address and phone number. If you have any questions, we would love to answer them. And you can also visit our website, Chicagolandmedicare.com or brickhouseagency.com. Both of them have very convenient tools on there that allow you to schedule an appointment if you want to schedule a consultation because you have some questions. It's very easy to go to either one of those websites and schedule a consultation. So please do that if that's the easiest way for you to reach out to us. And Chicagolandmedicare.com in particular is a wonderful resource as well. We have frequently asked question page on there. We define all these parts of Medicare that we talked about today. So please utilize that as well, just as a good resource tool for you. Thank you very much. And like I said, if you have any questions, please reach out.